Alright, so this first video I'm going to be doing shoulder palpation, shoulder active range of motion, some shoulder passive range of motion, shoulder MMT, and then a mobility assessment. So first, for shoulder palpation, I'll be having the patient seated. And to find the AC joint, I'm going to go along the spine of the scapula and the clavicle, and then just meet my way in the middle, finding the lateral edge of the acromion. And then I feel a little squishy right here. That indicates that it's the AC joint. Does that hurt a little bit? Okay. Alright, so then moving into, so from here, and then I would palpate at different types of pressure to check for any kind of symptoms, and it seems like this is reproducing symptoms for him. So then moving anteriorly, just about an inch, I can come on the biceps tendon. And I can kind of feel the tension moving, but to confirm that I'm on it, I can have the patient go into a little bit of internal external rotation. And I can feel the tendon popping out. And I can feel it moving through the bicipital groove. And there it is right there. Got that rope-like feeling, kind of like with the tendon in the snap. So next I'm going to palpate for the supraspinatus tendon. So coming off the lateral side of the acromion, I can come across and I can feel the tendon popping right there. Is that a little uncomfortable too?
Yeah, okay.
And then coming off coming off of that about an inch, I can come on the greater tuberosity of the biceps. There it is. And then from the greater tube, I can go posteriorly and I can palpate for some of those posterior capsule muscles, specifically infraspinatus, and then just inferior to that, teres minor. So that's shoulder palpation. So next we're going to be looking at shoulder active range of motion. So first flexion, I'm just going to ask the patient to bring his arms all the way up to the ceiling. And I'll be looking for any kind of discrepancies, like maybe different heights with flexion, any kind of pain that's reproduced. And I would do that for all the kinds of motions that I'm doing. So, and then for passive, I'll just have the patient relax, and then I'll bring it up and see if maybe I can get any more motion than just his active range of motion would let him. I'm getting a little bit more there, and then maybe I can have some overpressure, see if any symptoms kick in. And then abduction, I'm going to ask him to bring it out to the side and all the way up. Okay? And then I can add some overpressure to see if any of those symptoms kick in. And then same idea for passive, just have the patient relax his muscles and try to bring that shoulder up as far as I can. For extension, I'm just going to ask the patient to bring his arms all the way out to the back, and then adding overpressure, and then relax, and then just continue that with passive to see if I can really get an idea of how the joint mobility is for extension. External and internal rotation. I need the patient to be supine or to be seated, and his arm about 90 degrees abduction. And I'm also going to apply a force down on the scapula, so that way when we do internal rotation, there's no scapular movement, to really get an idea of what the internal rotation is. So can you bring your arm down like this? And then just relax, and I can really assess. And then for external rotation, I'd ask the patient to bring his arm back like that. Just relax, and then for passive, I bring it back more. So that's the combination of shoulder active and shoulder passive range of motion. For MMT, first for shoulder flexion, I'm going to ask him to flex his shoulders about 90 degrees, and then stabilize and press down, just test the muscles. And then for shoulder abduction, bring it out 90 degrees, press down, push into my hand. And then for extension, I would get behind him and bring it back to midway, and then try to push him into flexion. Push into my hand. Good. And then for internal external rotation, I have the patient just cradle his arm on my shoulder again, and then push into my hand. This is testing external rotation, and then push into my hand, and this is testing internal rotation. And that's shoulder MMT. So lastly, for the shoulder mobility assessment, go ahead and lay down. Yep, on your back. So then for the inferior, just relax. Relax, I got you. So for any kind of mobility, I'm going to make sure that my patient's arm is around me, so that way there's more total contact, and it probably will relax them and make them less guarded. So since I'm in this position, I'll present an inferior glide. So finding the humeral head, and coming off a little bit of it, and then with this kind of feet positioning, I'm going to basically do a forward lunge to perform an inferior glide. And the more that my hand is touching his humerus, the better it will feel for the patient. Okay. And now for a posterior glide. Same process, just relax, I gotcha. So with the posterior glide, because of the setup of the glenoid cavity, I need to add a little bit of distraction to get the humerus away from the cavity, so that way I can really perform the glide. Scoot a bit closer to me. So once again, finding the humeral head, and then coming just off of it. With this hand, I'm going to add a little bit of distraction, and then I'm just going to apply the downward force, a posterior lateral force, so that way the humeral head is moving in the direction that it would during like abduction or adduction. And again, total contact, and then just a downward force. And then I can do grades 1, 2, or 3, or 4, just depending on how the patient feels. And that's shoulder palpation, active and passive range of motion, MMT, and mobility assessments.